When 41-year-old Randy Cooper walked into the emergency room, even his wife froze. The entire left side of his face was grotesquely swollen. One eye had nearly disappeared beneath the swelling. His nose burned with a deep crimson color, and every breath sounded like a struggle. The doctors had seen allergic reactions before. This wasn't one of them. Just 3 weeks earlier, Randy looked perfectly healthy. The only thing that had changed was a habit millions of people never think twice about. Every single day, he reached for the same over-the-counter nasal spray. At first, it seemed to help. Then it stopped working, so he used it more. As the congestion grew worse, the pressure inside his face became unbearable. Antibiotics did nothing. Painkillers barely touched the pain. And with every passing day, the swelling spread farther across his face. By the time specialists finally uncovered what was really happening, Randy wasn't just in danger of losing his ability to breathe. Every hour they waited meant the infection could spread farther. How could something as ordinary as a nasal spray become the first clue to one of the most terrifying diagnoses the doctors had ever seen? This is hidden pathogens.
This is hidden pathogens?
3 weeks earlier, nothing about Randy Cooper's life suggested he was about to become a medical mystery. At 41 years old, Randy worked as a commercial truck driver based in New Orleans, Louisiana. Long hours behind the wheel had taught him to deal with almost anything: traffic, bad weather, aching muscles, and sleepless nights. His wife, Marilyn, often joked that Randy always found a way to solve his own problems, until one refused to go away. For years, he had struggled with constant nasal congestion. Spring made it worse. Fall wasn't much better. Even during the winter, he often woke up unable to breathe through his nose. By morning, he felt exhausted, and spending 10 or 12 hours driving while fighting congestion became miserable. He tried allergy pills, he tried saline rinses, he even replaced the air filters throughout the house. Nothing seemed to last. Then one afternoon, while picking up groceries before a delivery route, he noticed an over-the-counter nasal spray that promised fast relief. Within minutes of the first spray, he could breathe again. It felt like a miracle. That night, he slept straight through until morning for the first time in months. The next day, he told a fellow driver at a truck stop, "This stuff actually works," Randy said with a grin. At first, he followed the instructions exactly. A spray in the morning, another before bed. But a few days later, the congestion came back. So he used another spray, then another the next day. Soon, the small bottle never left his side. It sat in the cup holder of his truck. He reached for it before every shift, before bed, sometimes at a red light, sometimes in the middle of the night when he woke up gasping through his mouth. Each spray opened his nose within minutes. But the relief never lasted as long as it had before. Without realizing it, Randy found himself reaching for the bottle more often each week. He told himself his allergies must be getting worse. He never imagined the very thing helping him breathe could also be trapping him in a cycle he couldn't see. And while everyone, including Randy, focused on the congestion, something far more dangerous was quietly being overlooked. So why was his nose getting worse instead of better? At first, Randy didn't notice the change. The nasal spray still worked. It just didn't work for very long. Instead of lasting an entire day, the relief faded after a few hours. Then, after only an hour. Eventually, it seemed as though the moment the medication wore off, his nose slammed shut all over again. The congestion wasn't just coming back. It was coming back worse than before. Randy blamed the changing weather. Then he blamed pollen. Then he blamed another miserable allergy season in Louisiana. The possibility that the spray itself had become part of the problem never crossed his mind. So he bought another bottle, then another. Before long, he kept one in his truck, one beside the bed, one in the bathroom, and another tucked inside his jacket pocket. If he forgot one at home, he'd stop at the nearest pharmacy before starting his route. Breathing through his nose had become something he couldn't risk losing. His wife, Marilyn, was the first to notice. "You're using that stuff a lot lately," she said one evening as Randy reached for the bottle during dinner. "I'm just stuffed up," he replied with a shrug. "It opens me right back up." She wasn't convinced. "You didn't used to need it this much." Randy laughed it off. "It's just allergies." But over the next several days, new problems began to appear. He woke with dull headaches that wrapped around his forehead. His cheeks felt strangely full, as if someone were pressing from inside his face. During long drives, he found himself rubbing the bridge of his nose without even realizing it. The pressure wasn't unbearable. Not yet. It was simply different. One afternoon, while unloading cargo, a sharp pain shot beneath his left eye. It lasted only a few seconds before disappearing. Randy ignored it. That evening, Marilyn looked at him across the dinner table. "Is your face a little swollen?" Randy walked into the bathroom and stared at the mirror. At first, he couldn't see anything unusual. Then he turned slightly toward the light. His left cheek looked different, barely. Just enough to make him wonder if Marilyn was right. He convinced himself it was nothing. Tomorrow, he thought, it'll be gone. But by the next morning, the swelling hadn't disappeared. It had gotten worse. So what was happening inside Randy's nose that no one, not even Randy, could see? While Randy believed his allergies were getting worse, something very different was happening inside his nose. Every time he sprayed the medication, tiny blood vessels lining his nasal passages rapidly tightened. That was exactly what the spray was designed to do. As those blood vessels narrowed, the swollen tissues inside his nose shrank within minutes, opening his airways almost instantly. That's why the relief felt so dramatic, but the medication was never meant to be used every day for weeks. As the hours passed and the medicine wore off, those same blood vessels widened again. Only this time, they expanded even more than before. More blood rushed back into the delicate tissues. The lining of Randy's nose became increasingly swollen, irritated, and inflamed. The congestion he felt wasn't simply returning. His own body was overreacting each time the medication wore off. Without realizing it, Randy had become trapped in a vicious cycle. The more congested he became, the more he reached for the spray. And the more he reached for the spray, the worse the congestion became. Day after day, the constant inflammation began blocking the tiny drainage channels connecting his sinuses to his nasal cavity. Those narrow openings are responsible for allowing mucus to drain and fresh air to circulate through the sinuses. But Randy's weren't working the way they should. Instead of draining normally, thick mucus began collecting inside the dark, warm spaces behind his cheeks, forehead, and eyes. Pressure slowly built where it couldn't be seen. At first, his immune system kept everything under control. He felt nothing more than stubborn congestion, occasional headaches, and a growing pressure across his face. From the outside, it still looked like ordinary allergies. Even Randy believed that. But behind the swollen tissue, the environment inside his sinuses was becoming increasingly abnormal. With every passing day, less air reached those spaces. Secretions lingered longer, inflamed tissue struggled to recover, and as the congestion continued, another problem quietly began taking advantage of the conditions developing inside Randy's nose. Neither Randy nor his doctors had any reason to suspect it. Because everything still looked like nothing more than a man with unusually bad allergies. But if those hidden changes continued, the next symptoms would be impossible to ignore. So why was the pressure inside Randy's face about to become something far more dangerous? Randy woke before sunrise, with a deep, throbbing pain spreading across the left side of his face. At first, he blamed another restless night. He stumbled into the bathroom, splashed cold water over his face, grabbed the nasal spray from the counter, and waited for the familiar relief. Nothing. He sprayed again, still nothing. For the first time in weeks, the one thing he had depended on every single day had completely stopped working. The pressure behind his cheek only grew worse. By the time Randy climbed into his truck, the pain had settled deep beneath his left eye, pulsing with every heartbeat. He turned the key. The engine rumbled to life. As he pulled onto the highway, every bump in the pavement sent another jolt through his face. He kept telling himself he could finish the route. Then, while checking his blind spot, a sudden stab of pain exploded beneath his eye. His vision blurred for a split second. The truck drifted toward the shoulder. The rumble strips roared beneath the tires. Randy gripped the steering wheel and pulled the truck back into his lane, his heart pounding so hard he could hear it. He drove the next few miles in complete silence. When he finally stopped at a fuel station, he caught his reflection in the driver's side mirror. He froze. His left cheek looked swollen. The skin beneath his eye appeared stretched and tight, as though something beneath it was slowly pushing outward. He stared for several seconds. "Maybe I'm imagining it," he whispered. A few minutes later, another truck driver walked over. "You all right, Randy?" Randy forced a smile. "Yeah, probably just a sinus infection." The other driver studied his face for a moment. "You might want to get that looked at." For the first time, Randy couldn't laugh it off. When he finally arrived home, Marilyn opened the front door and immediately stopped walking. Her smile disappeared. "Randy," she stepped closer. "Look at me." He tried to shrug it off. "It's nothing." "No." Her voice was firmer now. "Don't turn away." He looked back at her. She slowly reached toward his face, but stopped just short of touching it. "Your eye." Randy hurried into the bathroom. Under the bright light, the swelling was impossible to ignore. His left cheek had become noticeably larger than the right. His lower eyelid looked puffy. The bridge of his nose was beginning to redden. Just seeing it made his stomach tighten. "I'll go tomorrow," he said quietly. Marilyn shook her head. "No. You're going today." At the urgent care clinic, the physician carefully examined Randy's face, looked inside his nose, and listened as he described weeks of congestion, constant nasal spray use, and the sudden swelling. The doctor nodded. "It looks like you've developed a severe sinus infection." He prescribed antibiotics, pain medication, and instructed Randy to stop using the nasal spray immediately. For the first time in weeks, Randy felt relieved. Finally, he had an answer. He went home, took the first dose of antibiotics, and went to bed, believing the worst was over. But when Marilyn woke him early the next morning, she gasped. The swelling had spread across nearly half his face, and his left eye was beginning to swell shut. So why was Randy getting dramatically worse after starting treatment? Marilyn didn't drive Randy back to urgent care. She drove straight to the emergency room. By the time they arrived, the swelling had spread across nearly the entire left side of his face. His left eye was now so swollen he could barely open it. The pressure inside his cheek had become a relentless, crushing pain that made it difficult to speak. Even breathing through his nose was impossible. A triage nurse looked up from her computer, took one look at Randy, and immediately called for a wheelchair. Within minutes, he was lying in an emergency room bed while doctors examined his face. His temperature was elevated, his heart rate was climbing. Lab tests showed signs of significant inflammation. Everything pointed toward a severe infection. The emergency physician reviewed the notes from urgent care. "So the antibiotics haven't helped?" Randy slowly shook his head. "It's worse." The doctor frowned. "That's unusual." A CT scan was ordered immediately. As Randy was wheeled into radiology, Marilyn squeezed his hand. "It's probably just a stubborn infection," she whispered. Randy wanted to believe her, but deep down, he knew something wasn't right. The scan showed that several of his left-sided sinuses were completely filled. The tissues inside his nose were severely swollen. There was obvious inflammation extending into the soft tissues of his face. The findings explained why Randy was in so much pain, but they still didn't explain why he was getting dramatically worse despite antibiotics. The emergency team admitted him to the hospital. They switched him to powerful intravenous antibiotics, stronger than anything he had taken at home. The doctors expected him to improve within a day. Instead, he got worse. Late that night, Randy woke with a stabbing pain behind his left eye. He rubbed his face, then suddenly stopped. His vision seemed different. He covered his right eye. The room looked strangely dim through his left. He blinked several times. Nothing changed. Panic crept across his face. He pressed the call button. Within seconds, nurses rushed into the room. "What's wrong?" Randy swallowed hard. "I can't see very well out of my left eye." The room fell silent. One nurse immediately shined a light into both of his eyes. Another hurried out to find the physician. Only hours earlier, this had looked like a severe sinus infection. Now, something was threatening Randy's vision, and everyone in the room realized they might be dealing with something far more dangerous than anyone had first believed. So what disease could spread from the sinuses to the eye in just a matter of days? By the second morning in the hospital, Randy should have been improving. Instead, he looked worse. The swelling had spread across nearly the entire left side of his face. His eyelid was now so swollen that he could barely force it open. Even speaking had become painful. The intravenous antibiotics continued dripping into his arm, hour after hour, but nothing changed. If anything, the pressure inside his face was becoming unbearable. An infectious disease specialist stopped by Randy's room early that afternoon. "Tell me exactly how this started," she said. Randy explained everything: the allergies, the nasal spray, the weeks of worsening congestion, the headaches, the facial pressure, then the swelling. She listened without interrupting, occasionally writing notes in his chart. When he finished, she examined his face in silence. Then she gently lifted his left eyelid. "Can you follow my finger?" she asked. Randy tried. His right eye tracked it easily. His left struggled. "Is the room darker on this side?" she asked. Randy hesitated. "Yeah." "What about double vision?" "Sometimes." The specialist's expression changed. She stepped into the hallway. Marilyn watched through the partially open door as the doctor spoke quietly with the emergency physician. A few moments later, another doctor joined them. Then another. Within minutes, 4 physicians were standing around Randy's CT scans, pointing to different areas while speaking in low voices. Marilyn couldn't hear the conversation, but she didn't need to. Something had changed. A nurse entered Randy's room carrying paperwork. "We're taking you for another scan," she said. "I just had one." "I know. This one needs to be done right away." Less than 30 minutes later, Randy was inside the MRI machine. The loud, rhythmic pounding echoed through the narrow tunnel as he struggled to stay perfectly still. Every second felt longer than the last. When the scan was finished, the technician didn't say a word. Instead, she looked at the images on her monitor, paused, then quietly stepped out of the room. She returned moments later with the radiologist. The two of them stared at the scans together. Neither spoke. Randy felt his pulse quicken. He had seen that look before, not in hospitals, on the highway. It was the same expression people made just before telling someone that something had gone terribly wrong. Back in his hospital room, the atmosphere had completely changed. The nurses who had chatted with him that morning were suddenly moving much faster. His antibiotic bag was disconnected. A new medication was ordered. No one explained why. Finally, the infectious disease specialist walked back into the room. She pulled up a chair beside Randy's bed. Then she asked a question no one else had thought to ask. "Randy, have you ever been diagnosed with diabetes?" Why would a simple question about diabetes suddenly become the most important question in Randy's entire medical journey? Before we continue, if you're fascinated by real medical mysteries like this, share this video and subscribe to this channel. And if you value these videos, there's a free link in the description and pinned comment that helps support the channel. Even if you've clicked it before, endeavor to click on it again with every new video you watch from this channel. Every bit of click helps us continue researching and telling these stories, and it's completely free. Now, let's continue. Randy looked at the infectious disease specialist in confusion. "Diabetes?" he asked. "I've never had diabetes." The doctor nodded. "Maybe not, but we're going to make sure." Within minutes, nurses were drawing more blood, not just to measure inflammation. They checked his blood sugar, his kidney function, his immune system. Every result that might explain why a man who had been healthy just weeks earlier was now losing vision despite powerful antibiotics. As the blood samples disappeared down the hallway, more specialists began arriving. An ear, nose, and throat surgeon, an ophthalmologist, another infectious disease physician. One by one, they examined Randy. The ophthalmologist asked him to cover his right eye. "Tell me how many fingers I'm holding up." Randy hesitated. 3? It was 2. The room became noticeably quieter. Next, the ENT surgeon carefully examined the inside of Randy's nose using a thin camera. The monitor displayed swollen tissue and narrowed passageways. He slowly guided the scope farther. Then, he stopped. No one in the room said a word. The surgeon leaned closer to the monitor. An assisting nurse glanced at the screen. Her expression changed. "What is it?" Randy asked. The surgeon didn't answer immediately. Instead, he gently withdrew the camera. "I'd like to examine this more closely," he said calmly. "We'll need to take a small tissue sample." "A biopsy?" The surgeon nodded. "It's the quickest way to get the answers we need." A few hours later, Randy was wheeled into the operating room. After he was asleep, the surgeon once again guided the endoscope through the swollen nasal passages. The operating room remained unusually quiet. The surgeon spent longer than expected examining one particular area. Finally, he collected several tiny tissue samples. Each was carefully labeled and rushed directly to the pathology laboratory. Back in his hospital room, Randy searched Marilyn's face. What did they find? She forced a reassuring smile. "They're still waiting on the biopsy." Hours passed. Every minute seemed longer than the last. Then the phone rang in the pathology department. The preliminary results were ready. The pathologist studied the slides under the microscope. He paused, looked again, then quietly picked up the phone. A few moments later, the infectious disease specialist received the call. She listened without interrupting. When the conversation ended, she didn't speak. She simply closed Randy's chart, looked toward the intensive care unit, and immediately asked the hospital operator to assemble the entire treatment team. Whatever the biopsy had revealed, it had changed everything. What could a single tissue sample reveal that made an entire team of specialists respond with such urgency? The treatment team gathered around Randy's scans, laboratory results, and biopsy report. For several long moments, no one spoke. Finally, the infectious disease specialist looked at Randy and Marilyn. "We know what's causing this." She took a slow breath. "This isn't a bacterial sinus infection. It's an invasive fungal sinus infection." The room fell silent. Neither Randy nor Marilyn had ever heard those words before. The doctor pulled a chair beside Randy's bed. "I know this sounds frightening," she said, "but it's important that you understand how we got here." She pointed to the scans displayed on the monitor. "For weeks, your nose had been trapped in a condition called rhinitis medicamentosa, also known as rebound congestion." She explained that the over-the-counter nasal spray wasn't dangerous when used as directed. Its job was to temporarily shrink swollen blood vessels inside the nose, allowing air to pass through more easily. "But these medications are only meant to be used for a few days," she continued. "When they're used over and over again, The blood vessels rebound after the medicine wears off. The tissues swell even more than before, making the congestion feel worse. That causes many people to use the spray again, and the cycle repeats. Randy slowly nodded. So, the spray caused the infection? The doctor immediately shook her head. No, the spray did not cause the infection. It caused the rebound congestion that kept your nasal passages inflamed and your sinuses from draining properly. But something else made this infection possible. She opened another page in Randy's chart. When you arrived at the hospital, we checked your blood sugar. It was far higher than normal. She looked directly at Randy. We believe you've been living with undiagnosed diabetes. Randy stared back at her. I have diabetes? It's very likely. She explained that uncontrolled diabetes can weaken the body's ability to fight certain aggressive infections. Then she pointed back to the scan. Fungal spores are everywhere. They're in the air we breathe every day. Most of us inhale them without ever becoming sick because our immune system clears them before they can take hold. But in your case, two things happened at the same time. Your sinuses remained blocked and inflamed for weeks because of the rebound congestion. And your previously undiagnosed diabetes made it much harder for your body to stop an invasive fungus once it began growing. She paused to let the words sink in. The biopsy confirmed that the fungus had invaded the tissues inside your sinuses. It wasn't just sitting on the surface anymore. It had begun invading blood vessels, reducing blood flow to nearby tissue and spreading toward your left eye. Suddenly, every symptom made sense. The relentless congestion, the facial pressure, the swelling, the unbearable pain, the failing vision, and the reason every antibiotic had failed. They were treating bacteria, the specialist said quietly, but bacteria were never the problem. Marilyn reached for Randy's hand. Can you treat this? The doctor's expression remained serious. Yes, but we have to move immediately. She explained that powerful intravenous antifungal medication would begin that same day, but medicine alone wouldn't be enough. The surgeons would also need to remove every piece of infected tissue they safely could before the fungus spread any farther. Every hour mattered. Because if the infection reached Randy's brain, the chances of saving his life would become dramatically lower. Just weeks earlier, Randy had bought a simple nasal spray to help him breathe. Now an entire surgical team was preparing to fight an infection that could cost him both his eyesight and his life. Would surgery stop the fungus before it reached Randy's brain? Within an hour of receiving the biopsy results, Randy's hospital room became a blur of activity. Nurses adjusted IV lines. Consent forms appeared at his bedside. The operating room was being prepared. Everything was happening so quickly that Randy struggled to keep up. An ear, nose, and throat surgeon sat beside his bed. I need you to understand why we're moving this fast, he said. The fungus isn't just causing an infection, it's invading the tissue itself. He pointed to Randy's latest scans. Medication can slow it down, but once this type of fungus enters tissue and blood vessels, dead tissue becomes a place where medicine can't reach effectively. Randy looked at him in disbelief. So, what happens now? We have to remove every piece of infected tissue we can safely find. The words hung in the air. Remove it? The surgeon nodded. If we leave infected tissue behind, the fungus can continue spreading. Marilyn tightened her grip on Randy's hand. Does that mean part of his face? The surgeon paused before answering. Our first priority is saving his life. If we have to choose between preserving tissue and stopping the infection, he didn't finish the sentence. He didn't have to. The room fell silent. For the first time since this nightmare began, Randy wasn't thinking about congestion, or headaches, or even his eyesight. He was wondering whether he would wake up looking like the same person. Minutes later, he was wheeled toward the operating room. Bright surgical lights reflected off the polished floor as doctors and nurses hurried alongside his bed. The anesthesiologist introduced herself. We're going to take good care of you." Randy managed a nervous smile. As the operating room doors opened, he glanced one last time at Marilyn. "I'll see you soon," he whispered. She forced herself to smile back. "You'd better." Inside the operating room, the surgical team reviewed the scans one final time. The ENT surgeon stood at the head of the table. "If the infection has spread farther than the imaging shows," he said quietly, "we'll have to remove more tissue than we planned." No one responded. Everyone in the room understood exactly what that meant. As Randy drifted off under anesthesia, the surgeons prepared for one of the most delicate operations of their careers. Because the fungus wasn't just threatening his face anymore, it was only millimeters away from the structures protecting his brain. Would the surgeons be able to remove the infection before it spread beyond the point of no return? The operation lasted nearly 5 hours. Outside the operating room, Marilyn sat alone in the waiting area, staring at the same set of double doors. Every time they opened, she looked up. Every time, it was someone else. A nurse, a transporter, another family, but never Randy. Inside the operating room, the surgeons worked methodically. Using a tiny endoscope inserted through Randy's nasal passages, they carefully removed infected tissue from deep inside his sinuses. Every few minutes, another sample was sent to the pathology laboratory. The goal wasn't simply to remove what looked infected. It was to keep removing tissue until the pathologist could no longer find evidence of fungal invasion at the edges of the samples. The challenge was that some of the most critical structures in the human body were only millimeters away. Just beyond the infected tissue lay Randy's eye socket. Above it, a paper-thin layer of bone separated the infection from his brain. There was no room for error. Back in the waiting room, nearly 4 hours had passed. Marilyn's phone remained silent. She had stopped trying to read, stopped trying to distract herself. She simply waited. Finally, the operating room doors opened. The lead surgeon walked toward her, still wearing his surgical cap. Marilyn stood immediately. "How is he?" The surgeon took a slow breath. "We removed a significant amount of infected tissue." Marilyn searched his face. "Did you get it all?" "We removed everything we could safely identify." The pause that followed felt endless. But with infections like this, he continued carefully, "there's no guarantee. Microscopic areas haven't spread beyond what we can see." Marilyn felt her stomach tighten. "So what happens now?" "Now we wait." Randy was transferred to the intensive care unit. Strong intravenous antifungal medication continued around the clock. The next 48 hours would be critical. The medical team checked his neurological function every few hours. They examined his pupils, tested his vision, monitored his speech, watched for even the smallest sign that the infection had spread. When Randy finally woke, his head felt heavy. His nose was packed with surgical dressing. His throat was sore from the breathing tube. For a few terrifying seconds, he couldn't remember where he was. Then he noticed Marilyn sitting beside his bed. She smiled through tears. "You made it." Randy slowly raised his hand toward the left side of his face. The bandages covered much of his nose and cheek. His voice was barely a whisper. "My eye?" The ophthalmologist stepped closer. "It's still there." Randy let out a shaky breath. "But," the doctor continued gently, "your vision is still very limited." No one knew whether it would recover. The surgery had stopped the infection. Now the question was whether the damage it had already caused could ever be reversed. Would Randy regain his sight, or had the fungus already taken it forever? The days that followed passed one careful step at a time. Every morning, Randy woke to another examination. Doctors checked the swelling around his eye, tested his vision, reviewed fresh blood work, and searched for even the smallest sign that the fungus had returned. So far, it hadn't. The powerful intravenous antifungal medication continued around the clock. Unlike antibiotics, this wasn't a treatment measured in hours. It would take weeks before anyone could confidently say the infection was truly gone. The waiting became its own kind of battle. Several days after surgery, the infectious disease specialist entered Randy's room carrying the latest pathology report. This time, she was smiling. The final results are back. Randy held his breath. We achieved clean surgical margins. There are no signs of fungus in the remaining tissue we removed. For the first time since he had walked into the emergency room, the entire medical team allowed themselves to believe he was going to survive. But survival wasn't the same as recovery. When the bandages finally came off, Randy stood quietly in front of the bathroom mirror. For several long seconds, he didn't look up. When he finally did, he barely recognized the exhausted man staring back at him. The swelling had gone down, the redness had faded, the incisions were healing well. He had lost weight. There were scars that hadn't been there before, but he was still himself. Marilyn quietly stepped beside him. Neither of them spoke. She simply reached for his hand. After everything they had been through, words didn't seem big enough. The next challenge was his eyesight. The ophthalmologist dimmed the examination room lights. "Cover your right eye." Randy obeyed. "What can you see?" At first, only shadows. A few days later, shapes. Another week passed. He could make out the outline of a chair across the room. Then one morning, Marilyn walked into his hospital room, carrying fresh clothes. Randy smiled. "I can see you." She stopped walking. "You can? I can't read the name on your badge yet." He laughed softly. "But I know it's you." Marilyn covered her face as tears rolled down her cheeks. Then she laughed too. It was the first time laughter had filled the room since Randy had been admitted. Several weeks later, Randy walked out of the hospital under his own strength. His vision wasn't perfect. It might never be. He would continue taking antifungal medication for weeks, attend regular follow-up appointments, undergo repeat scans, and work closely with his doctors to make sure the infection never returned. Recovery, they told him, would be a marathon, not a sprint. A few days after returning home, Randy walked into his bedroom. On the nightstand sat the nearly empty bottle of nasal spray. He picked it up, turned it over in his hand. For weeks, that tiny bottle had felt like the only thing helping him breathe. He remembered carrying it everywhere, keeping one in his truck, another beside his bed, never leaving home without it. Slowly, he walked to the trash can, dropped it inside, then stood there quietly for a moment. It wasn't the bottle he was saying goodbye to. It was the version of himself who believed that every problem could be solved with one more spray. Just weeks earlier, Randy had bought that bottle without giving it a second thought. Now he understood something he never would have imagined. The most dangerous illnesses don't always begin with dramatic symptoms. Sometimes, they begin with an everyday habit that seems completely harmless. Would Randy ever breathe the same way again? Perhaps. But he knew one thing for certain. He would never ignore what his body was trying to tell him again. Months after leaving the hospital, Randy's life had settled into a new routine. He had returned to work. The swelling was gone. Most people who met him had no idea how close he had come to losing both his eyesight and his life. His vision had improved, although it never returned completely to what it had once been. He still attended regular follow-up appointments, every scan, every examination. Every doctor's visit carried the same quiet question. Had the infection come back? Fortunately, it never did. Randy's diabetes was now under control. With treatment, lifestyle changes, and careful monitoring, his blood sugar gradually returned to a healthier range, reducing the risk of future complications. Looking back, Randy often replayed the entire ordeal in his mind. It hadn't started with unbearable pain, or dramatic swelling, or emergency surgery. It had started with something almost everyone has experienced: a stuffy nose, a bottle of nasal spray, and the belief that one more spray would fix the problem. His doctors later explained that nasal decongestant sprays can be very effective when they're used exactly as directed. For most people, they provide safe, short-term relief from congestion. The danger wasn't the medication itself. It was relying on it for weeks, instead of days, while ignoring symptoms that were steadily becoming more serious. Rhinitis medicamentosa, or rebound congestion, is a well-recognized condition caused by prolonged use of certain nasal decongestant sprays. The congestion often feels so severe that people continue using the spray, unknowingly trapping themselves in a cycle that's difficult to break. In Randy's case, that prolonged blockage was only one piece of a much larger puzzle. His previously undiagnosed diabetes had quietly reduced his body's ability to fight an aggressive fungal infection that most healthy people would never develop. The two conditions collided at exactly the wrong time. One created the opportunity, the other removed his body's defenses. Together, they nearly cost him everything. Stories like Randy's are extraordinarily rare. Millions of people use nasal sprays safely every year without developing invasive fungal infections. But his experience reminds us of something every doctor hopes patients will remember. When symptoms keep getting worse instead of better, when medications stop working, when your body is telling you that something isn't right, don't just keep treating the symptom. Find the cause, because sometimes the greatest danger isn't the illness you know you have, it's the one silently growing while everyone is looking somewhere else. And in Randy's case, that hidden danger was only discovered just before it was too late. If you made it all the way to the end, thank you. These stories take a lot of research to put together. If you'd like to support the channel, you'll find a free link in the description and pinned comment. Checking it out helps support future videos. Even if you've clicked it before, endeavor to click on it again on every new video you watch from this channel. Every click allows us to keep bringing these cases to the channel, and it's completely free. If you learned something from this case, like, share, and subscribe for more real medical stories. And if you chose not to subscribe, leave a comment and tell me what would make these videos better. I read far more comments than you might think. This is Hidden Pathogens. I'll see you in the next diagnosis. Good night.
This is Hidden Pathogens.